more than 15, 16 months into the pandemic. Hopefully we are starting to emerge, but COVID-19 is still very much with us. We want to bring in Ruthanne Sudderth. She's the Senior Vice President in Public Affairs and Communications with the Michigan Health and Hospital Association. Ruthanne, great to have you with us again.
Thanks for having me. It's good to be here.
I feel like this has been such a roller coaster ride, not only for the public, but for all of those in the healthcare industry as well.
It sure has. It's been a long 15, 16 months. We've seen multiple surges, and we're really happy to see this downward trend that we're on here in Michigan and in many other parts of the nation. But we're not quite out of the woods yet. We're still really focused on getting people vaccinated to protect themselves and those around them. And as was mentioned earlier, the Delta variant is on the rise, and we certainly want to nip that in the bud and make sure we have herd immunity before it really takes hold here in Michigan.
So if we can talk about that a little bit, can you explain more about the variants and why it's so important for people to get vaccinated now?
Sure. So, the more that this virus spreads, the more it has an opportunity to mutate and create new variants. And the good news is that right now, we know that the vaccines that we have available that are safe and effective can prevent people from catching these variants, and it can stop the spread of the disease and prevent new variants that may not be, as susceptible to these vaccines. So every person that can get vaccinated that hasn't yet should do that as soon as possible. We need to get to that 70% mark here in Michigan to really create herd immunity and protect those who can't get vaccinated, especially our younger children.
Are you concerned as the summer comes and more restrictions are lifted here in the state of Michigan?
I'm confident that moving forward with lifting the restrictions is the right thing to do because we are seeing so few cases now. I think in Ingham County here where I live, we reported no new cases yesterday, which was a great milestone to see. But we still have to be cautious. There are folks who are not yet vaccinated who can spread this disease. The thing that I want people to know is that about 99% of the people who are now being hospitalized for COVID-19 have not been vaccinated. These vaccines are safe and effective, and they can keep you out of the hospital and prevent it from spreading to your family. So that's the number one thing we want folks to understand today.
So with that, you mentioned hospitalizations. How are the hospitals doing right now? Because the cases are coming down.
They are. We're feeling much better about where we stand with COVID hospitalizations. We just have a few hundred as of today from our peak up in the 4,000s, which was really difficult this spring. But hospitals are still managing some challenges, and those include seeing a huge influx of patients for non-COVID related illnesses because people may have delayed care during the pandemic. And so that's really stretching some of our staffs thin, and it's difficult to manage. We're also seeing very, significant reductions in other childhood vaccinations, which is concerning. We certainly don't want to have an outbreak of measles or something else that's totally preventable. So those are two things that are still challenging our hospitals, even though COVID is improving here in Michigan.
Ruthanne Sudderth with us here on the MegaCast. She's a Senior Vice President for Public Affairs and Communications with the Michigan Health and Hospital Association. Ruthanne, when it comes to the healthcare workers, it's been an exhausting time because they have been on the front lines every single day. Is there concern right now in the healthcare industry that you're not going to have the staff needed to go forward?
The reality is that staff are burned out, and it's been a stressful year for them. So we are doing everything possible to make sure that they get the treatment or the care or the time off that they need as we come out of this pandemic and hopefully reach a better place. So we're focused on things like employee wellness and treatment for their mental health and emotional health. I'm not concerned that we're going to be short-staffed. We are also definitely placing a focus on workforce development to make sure that people still want to come into the healthcare field. These are good-paying jobs that can't be outsourced, and it's a great career path for many of our Michiganders. So we want people to keep coming in and working in our hospitals.
I know a few years ago when I had friends trying to get into some of the nursing programs here in Metro Detroit, they were very competitive. It was hard to get into them at some of the colleges. Is that still the case?
The nursing shortages are a real thing these days. I don't know how many openings there necessarily are, but I think that seeing what the frontline workers have gone through has probably made people think twice about going into that career path. But they have also been our heroes throughout this entire journey and made a huge impact on families that couldn't be there with their loved ones. So we couldn't appreciate our nurses more and our other frontline workers more, whether it's environmental service workers, physicians, nurses, and the like. Just a tremendous effort on their part, and we're so grateful for it.
Yeah, and I feel like as we're coming out of the pandemic, we kind of lost focus of that. In the beginning, people were dropping off donuts and cookies and lunch, and that's really kind of gone by the wayside as we've continued on this COVID-19 path. But we have to remember they are still in the fight.
Absolutely. It's never too late to thank a nurse or a healthcare worker that you know in your life. They still need that support. They're still coming to work every day and have had to quickly transition to caring for COVID patients to patients with other illnesses. So they deserve our support in every way.
And with that, Ruthanne, as well, I know that, Houston Methodist Hospital made news this week because they were requiring some of their employees to get the vaccine, and then it ended up in federal court and that lawsuit was thrown out. Do you think some of our hospitals are going to follow suit and start to mandate this for all of their workers?
I don't think we're to that point yet here in Michigan, but those are conversations at the individual business level that some hospitals may be having, because the number one priority of every hospital in our state is to protect the safety of their patients who are vulnerable and their staff who are vulnerable. So I think that'll be evaluated going forward. Right now, the focus is still providing education to those staff who have been hesitant to get the vaccine and making sure their questions are answered before we reach the mandate state.
And I know the flu vaccine is not really comparable to the COVID vaccine, but some hospitals prior to this did require the flu vaccine. I know some workplaces required it as well.
Absolutely. There's a precedent for mandating vaccines, again, to protect the safety of sick patients and staff alike. And so for quite a few years now, we've had most hospitals in our state mandating flu vaccine for their staff and Tdap, which prevents other very serious illnesses to protect their patients and staff. So that's certainly not a new practice. And again, that's something that will be evaluated for the COVID vaccine as we get into further stages of this year and it gets full FDA approval.
I think that's one of the things, like the general public, maybe they're not aware of, that requiring a vaccine to work at a certain location, not necessarily new. It's just the COVID vaccine is so new. And with that, again, Ruthanne Sudderth with us here on the MegaCast. She's with the Michigan Health and Hospital Association. Ruthanne, if I can ask you, for the people that maybe still have not gotten the vaccine and they're hesitant because there is talk about, well, I already had COVID. Why do I need to get the vaccine? Why do they?
That's a great question. You do get some protection if you've previously had COVID, but it's nowhere near the level of protection that the vaccine antibodies can give you. So we urge people to get vaccinated as quickly as possible. But if you do have questions, please reach out to a reputable source, call your doctor's office, contact your local hospital or health department, or visit their website. There is a tremendous amount of information about the safety and effectiveness of these vaccines. No safety steps were skipped in the development of these vaccines. So please contact a reputable source and ask those questions so that you can get your shot as quickly as possible and get protected.
What's so hard is knowing that we have, more than 500,000 doses just here in the state of Michigan that are coming up on their expiration date. And we think about how desperate people were to get this vaccine back in the beginning.
Yes, we have certainly seen our supply and demand flip from where we were earlier in the year.
In just a few short months as well.
Yeah. It didn't take long, for sure. It was great to see people clamoring for the vaccine, and we've certainly seen a shift from these mass vaccination centers that we saw in many communities now to more community and local sites in neighborhoods and physician offices doing vaccinations. So I think we'll continue to see that trend. And this could be a vaccine that, it just ends up in everyone's doctor's office and they get it as part of their annual physical going forward. But we don't want to see those vaccines go to waste. So our hospitals are certainly making sure that they are sharing their supply with anybody who needs doses. And I know that our state health department is trying to understand how we can share these doses with others who are in need before they go to waste.
Yeah, I mean, it really is sad to think if they have to be thrown out and they, because they were spoiled. Ruthanne Sudderth with us again here on the MegaCast from the Michigan Health and Hospital Association. And I know, Ruthanne, another question from a lot of people in the general public surrounding wearing a mask. If I've been vaccinated, why should I still wear a mask, especially if I have to visit someone in the hospital?
Yeah, so, a mask, is still going to offer an additional layer of protection to you and, more importantly, to that other individual. In healthcare facilities in Michigan, a mask is still required, any type of healthcare facility. There are people in those facilities that have compromised immune systems. There are children who cannot get vaccinated. So it's incredibly important that if you're going into a healthcare facility that you still wear a mask. And then, when you're in other businesses that require it, they're trying to protect their customers and workforces as well. So, we urge people to be cautious. If you're vaccinated, you may not need to take that extra step. But if you're visiting a healthcare facility, you still need to wear a mask.
And think about the drop in flu cases last year. Maybe something like the mask maybe should just be worn, in the flu season, right? I mean,
I know, this was the first year my kids and I, weren't sick for 15 months and we had masks on all the time. So it might be something new that folks do in future flu seasons. We had very few flu cases, which was incredible to see. And I hope that continues.
And with that too, because I noticed that even going like shopping or to the grocery store, you don't see, number one, people masked up, but they're also not wiping down their carts like they did before, or hand sanitizing. It used to be you go in, the first thing you did was sanitize your hands coming out. Now this store shelves are stocked. You can get hand sanitizer and Clorox wipes and toilet paper. No problem there.
Can't forget about that.
So, but we learned these lessons, and should we keep doing some of these things?
I think the increase that we saw in hand washing is a good thing. I think that had something to do with how healthy people were this past flu season. Some of the extreme levels people went to probably doesn't need to continue, where they were disinfecting their cereal boxes and their fruit. As we learned that COVID spreads much more through the air than it does through touch. So you get through a pandemic and you learn these types of things. But I certainly hope that people saw the value in some extra hand washing, especially in the cold and flu season.
And singing "Happy Birthday," right? It's supposed to be so many seconds.
Yep. There are a few things that I think people wouldn't be sad if we kept these ways of, doing things going forward.
And with that too, remote working, I think I saw a study where they were talking about the reduction of how many people called in sick to work this past year as well. So there were some upswings to COVID-19.
I think so. It's you try to find the silver linings in a really difficult situation, and a lot of people got to spend more time with family, and they stayed healthier than they would have. So you hold on to those things, and and going forward, hopefully some of that continues.
Just a couple more minutes here with you on the show. Anything maybe I didn't touch on that you want to add? What other things are you working on there at the Michigan Health and Hospital Association?
We're a thing we touched on earlier is mental health, and not just of our healthcare workers, but of all of Michigan. We need more resources available for behavioral and mental health for everyone in our state, and that means places for folks to go that are appropriate care settings where they can get the help that they need when they need it. We need the people and the staff to treat those individuals when they need the care. So those are very high priorities for us, not just because our healthcare workers need mental health care, but everyone does. And so we are very laser focused with our legislature on finding ways to support additional behavioral health resources here in Michigan. And health equity is another thing that we're very focused on. The pandemic really shone a spotlight on some inequities in our healthcare system that we've long known about, but really were spotlighted in the last 15 months. And so we have a pledge out there that 130 of our hospitals have signed to end racism and to address health equity and make sure that everyone has equal access to high quality, affordable health care where there are no implicit biases or other things affecting the kind of care that they get and when they get it. So those are two really big priorities for us going forward.
And do you think, too, when we're talking about mental health, one of the big issues coming out of the pandemic is making sure that telehealth stays around?
Absolutely. We saw a huge surge in telehealth in the last year or so, and people figured it out. Physicians figured it out. The payers figured it out. And so, there are really very few barriers left to keeping that as a permanent part of our healthcare delivery system. People found it very convenient for the most part and could easily get the care they need for, whether they had a minor issue or even some mental health care services that can be delivered virtually. So that's a part of the system that we want to see stick around for the long haul.
Ruthanne Sudderth with us here on the MegaCast. She's the Senior Vice President for Public Affairs and Communications with the Michigan Health and Hospital Association. Ruthanne, we always appreciate your time and your insight and expertise as well.
Thanks so much for having me. Have a wonderful afternoon.